Hello everyone, I hope all of you are doing good. Today we'll be discussing a few doubts from conservative dentistry and endodontics. Let's move on to the first question, which says, in an endodontic file, D2 will be, the options are at tip of the instrument, at 2 millimeters from the tip, at 3 millimeters from the tip, or at 16 millimeters from the tip. So the answer here is at 16 millimeters from the tip of the instrument. Now the doubt here is why the question says D2 and why not D16. So before modification, D16 was known as D2. The picture here shows D16, and before modification it was known as D2. So that's why the question. Next question says, which of the following is more detrimental to the tooth structure during cavity preparation? Now this question is slightly incomplete as it does not mention what type of cavity preparation, which restorative material, whether composite or amalgam. As we all know that for composite, the dimensions are not that important. So considering this question is for amalgam, the best option out of these four would be pulpal depth. Why? Because we all know deeper is the caries, deeper is the cavity preparation, more are the chances of pulpal exposure. So the cavity depth is considered to be one of the most important factor in pulp reaction to irritation by cavity preparation, as well as deeper is the penetration, deeper is the chance of direct or indirect pulp exposure. Moving on to the next question, which says, setting time of zinc phosphate may be retarded by, and these are the four options. Now let's understand the concept first. Four techniques can extend the working time of zinc phosphate cement. Now the picture on the right side here is a direct picture from Phillips Anusavis, page number 370. So reading to the first point, first the powder liquid ratio can be reduced to produce a thinner mixture. So it says to reduce the powder liquid ratio, but this change will result in a lower initial pH of the cement, which will adversely affect the mechanical properties of the cement. Now coming on to the options. The first option says increase in ratio of powder to liquid. So this option is gone. Second option says diluting the liquid with water. This is also gone. As it says, you can decrease the ratio of powder to liquid to produce a thinner mixture, but eventually this will affect the properties. So first two options are gone. Now the second point here says smaller portions of powder should be mixed for the first few increments. Option C here says increase in addition of powder, whereas the explanation says smaller increments. So option C is gone. So D, which is the correct answer, which says decrease in addition of powder to liquid, that is smaller increments. So which is the correct answer. Now the other points for retarding the working time of cement is you can either prolong the spatulation time or you can have a colder mixing temperature. Now the next question is related to the treatment for root fracture and duration, as both flexible and rigid option is given in the explanation of pulse. So that is why the confusion. Now this again I have picked directly from Grossman, and what does it say is if the coronal segment is displaced, then reposition the segment as quickly as possible, and again it says with a flexible splint for 4 weeks. Okay, so if the coronal segment is displaced, then flexible splinting for 4 weeks, and the splinting here mentioned is flexible. But if the root fracture is near the cervical area of the tooth, the prognosis is not as favorable, then you need stabilization for a longer period of time, which is up to 4 months. There's also one more reference which is from IADT guidelines. IADT stands for International Association of Dental Traumatology, which recommends again a flexible splint for 4 weeks for root fracture teeth. In cases where root fracture occurred in the cervical third of the root, the recommendation is again for a flexible splint for 4 months. Moving on to the next question. If continuous hypersensitivity develops in a recently GIC restored tooth, what would be the indicated treatment be? Let's look at the options. The first option says no treatment. Of course, this is not the answer. Next option says remove the restoration and place ZOE. And moving on to the option D, perform direct pulp capping. Now both B and D are wrong. Why? Because if you read the question again and you read the question properly, it says continuous hypersensitivity. So continuous pain and continuous hypersensitivity indicates towards irreversible pulpitis. And what is the treatment plan for irreversible pulpitis? Root canal treatment or pulpectomy. So the correct option here is perform pulpectomy. Okay. Now there was a doubt which asked how much does gutta percha shrinks during thermoplastic application. So the answer here is 2% upon cooling. There was a doubt regarding understanding positive rake angle and negative rake angle. Okay. Now, first of all, understand here that the blue line marked here is the radial line. Radial line is the line connecting the center of the burr and the blade. And the rake face or the blade face is the surface of the burr blade on the leading edge. The leading edge is the rake face. Now it is a positive rake angle when the radial line is ahead to the face of the blade. Now you can see the direction of the burr movement, and in this direction, in this picture, the radial line is ahead of the face. So that is why this is a positive rake angle. When it coincides, it is a zero rake angle. And when the radial line is tailing the face of the blade, or you can say when the rake face is ahead of the radial line, as in this picture, then it is a negative rake angle. I hope this is clear now. Next question was, what are slots? Now, as you can see clearly in the picture, slots are 1 to 1.5 millimeters deep, box-like grooves prepared in dentine to increase the surface area. These are prepared in occlusal box, buccoaxial, linguoaxial and gingival walls to increase the retention and retentive features. Next question is, what is covert caries? And the answer here is hidden caries. Going on to the explanation. Occult caries or covert caries or hidden caries are the caries which are seen in people with low caries index, high fluoride exposure, suggestive of increased fluoride exposure. They are not diagnosed clinically but detected only on radiographs. They are also known as fluoride bombs or fluoride syndrome. Next question is, pulpal anesthesia starts to wear off in anterior tooth after? Now, the answer here is 15 to 20 minutes, and this is a direct pickup from Cohen, which says disadvantage of pulpal anesthesia is the possible duration of pulpal anesthesia, which is only 15 to 20 minutes. Next question or the next doubt asks for difference between scarification and bicuspidization. Now, they are almost similar techniques, where bicuspidization is surgical division of a molar, where the crown and root of both the halves are retained and prosthesis is given, generally seen where there is furcational pathosis or involvement of furcation area, as you can see in this picture. And skyfurcation, the roots are cut apart and they are rejoined by a crown which acts as an interradicular splint. Okay? Seen where roots are well supported by bone. In bicuspidization, you can see this separate prosthesis for both the halves. It is surgically divided and then they are treated like premolars. You can see two crowns are given here. Whereas in skyfurcation, they are rejoined by a crown which acts as an interradicular splint. That's all for today. Thank you.